So this video is to show how to order and authorize a blood transfusion or a blood component transfusion. I'm going to start off here from the doctor's work list end page, and I am using a custom list, but please use a patient list built off of a location with the appropriate secondary filters, which is a non-discharged patient and a location filter. And also to make sure that you have the regular day admission, inpatient and day cases selected. So if I select my patient from here, I'm going to go to the Manage End Page view and scroll down to New Order Entry. Within the Search New Order Entry results, I'm going to type in transfusion. This will bring up care plans at the end of this list. The one I'm interested in here is blood transfusion, adult greater than 50. If this is something that you do fairly regularly, you like any other order, you can make this a favorite just by clicking here and add it to the favorites folder. You'll find the favorites folder here under mine. So if I just go here now, you'll see that that order is now here along with my other favorites that I've added. So I'm going to click on this. This adds the order to the order basket at the top right, orders for signature. I can click on this and modify details. This will open what we call the scratch pad. And here you can see some details about to help you with the authorization of the blood. I'm going to close this top section down just to make it easier to show. And you can see here that there's some other orders that are going to be placed. 3 of them are pre-ticked. These are the vital signs orders, which will appear in Care Compass as tasks. And these will be completed for pre-blood transfusion, 15 minutes post-blood transfusion, and at the end of the transfusion. I'm going to leave those ticked. Under medications, although they're not exactly all medications underneath here, we have packed red cells, platelets, we have, there are some medication here as well, hydrocortisone, FFP, cryoprecipitate, these are all appear in the list below. Let's just go to packed red cells as the main example. And you can see here there's a few little symbols here which I could quickly explain. This is within a care plan. So this is a note with detail and obviously hyperlinks involved. This is a lab order, this one with like a little clipboard. This is an inpatient med with a pill. The little chain link indicates that there's a requirement to usually to do a linked orders. So if you check one of these things, 2 others will automatically be placed, because generally you generally would require these 3 things to happen. You may not particularly need this full blood count to be done straight away. If you don't want any of these things to happen, you can untick, but you need to provide an override reason. Usually patient condition change is about the only appropriate one. You can see here that the 2 specifically that have been linked are the blood component authorization. This is the one that's going to go onto the drug chart, and the order red blood cells, which is the lab order to say the cross-match order basically. Once we place these under orders for signature, it gives us a little information saying that for ordered red cells, when we sign the order, the blood transfusion laboratory will be automatically contacted, but just by the requisition printing out in the lab. So you don't necessarily need to ring them unless you have an urgent requirement for blood, in which case standard process is that you would ring the lab. A few details that you have to then fill in to complete the authorization of the blood, and this is the consent needs to be completed here. This patient is going to have a few other warnings because we don't have any results back on this patient here, so this is the warning to say that there's no hemoglobin level. Just going to put a reason in that we're going to bypass that. Same here with iron studies, no ferritin results exist for this patient. I'm going to just click OK for that, but you could here add orders at the same time. This is another warning, which is that we don't have a group and save sample on this patient. So at this point, I'm actually going to add this order for blood group and antibody screen. Click continue. So now I have the 3 items that I need to sign off here to sort out the ordering and transfusion of a unit of blood. Let's cover the top one first. So this is the drug chart. This is the authorization for transfusion. Here you have what we call an OEF, a order entry format, which needs filling in for each of these orders. And for blood components, the fields look like this. So you'll have a total number of bags at the top here, which can be amended. So if you want to give more than one, then you can. Obviously, ideally, you do one at a time, recheck. You'll need to have an indication. You can order, if you wish, in mils as well. This is specifically for adults less than 50 kilos. But if you wish to put that in, you can. You'll need to make sure that you do put in the approximate number of units that would tally with that approximate number of mils. Leave these generally unchanged, because this puts an unscheduled row on the drug chart, so that when you come to do the administration, it's easier to perform. Tick here that you've given the patient written information. We'll go to the next one. This is the actual cross-match request, so asking the lab for the number of units that you wish, and this obviously will tie into the number of units that you've prescribed. So we're going to order 1 unit. Here we've got specific requirements, field which you must complete. We'll select none. This is the date and time that you require it. So if we want it to be as soon as possible, we'll just put in today and now, but you can put a future date here, and then bleep number to contact. Let's go to the next order. Now this is our group and screen order here, and just put in a reason for transfusion, for pathology test as transfusion. Put in our bleep number, and we'll sign all these orders off. Okay, so if we let's go to the drug chart first, and we can see here that we now have the unit of blood on the unscheduled section of the drug chart. Go back in to see the orders that we've placed. We can see the 2 orders that we've placed here, which are both one is awaiting collection. The order red blood cells is currently defaulted to collected. However, very soon this will default to awaiting collection, and there's a good reason for that. I'm just going to explain that now. When we actually come to take the blood, so for the group and save, we will come up to specimen collection. We scan the patient's wristband, and here you will see the instructions for taking the blood for group and save. So it tells you which tube to put it in very helpfully. You're going to continue to label the tube at the patient's bedside by hand, checking the PPID with the patient. You'll then print off the label at the patient's bedside from the WOW using the Wi-Fi label printer, and then place that label into the bag. Do not stick it onto the tube. That will then go to the lab. When this latest update is done, you also will see here the order for red cells. And in a similar way, you will see here a drop down, click print. And when the blood is actually ready, which you'll be able to see from the results review section in PowerChart, you'll see the blood unit number. So you'll know the blood has been prepared and ready for collection. You'll click print requisition. This will print off an A4 page, which is basically the blood collection slip, and then we'll tick collected, and that will then remove this from the list. Okay, so that's the collection for the group and save done. And that's obviously how you would also go and get the blood later.